So now we're going to take a look at that other grouping of gram-positive rods, the bacteria that don't make endospores. And there are 4 main genus of bacteria that cause human disease that we'll talk about. So I'm going to break it down into kind of 2 little videos, the Listeria, Mycoplasma, and Corynebacterium, and then finish it out with a separate video on Mycobacterium. So Listeria, more specifically Listeria monocytogenes, sometimes just called L-mono, kind of like we call a lot of times Staphylococcus epidermidis, we call it S. epi. A lot of times, although not technical, we do shorten that species name even though you're not supposed to. Listeria monocytogenes, it's a coxobacillus, so it is a bacillus shape, but again, they're very short rods, almost getting closer to that cocci shaped. We pick them up by drinking contaminated beverages, eating contaminated foods. They do and can grow in colder temperatures. So a lot of times colder temperatures usually inhibit bacteria growth. For Listeria, cold temperatures doesn't inhibit them all that much. So even if you refrigerate foods, they can definitely still be growing Listeria. They are kind of their big virulence factor is that they are intracellular parasites. So they like and want to get eaten by macrophages, and then they can live inside of those macrophages. So they want to get ingested, then they hide out. It's a great hiding place. It allows it to survive longer, good for it, which unfortunately causes diseases for us. So some of the issues we can then have is it can cause fever, diarrhea, sore throat. That's usually if you have healthy immune system. And so, it's annoying. It's not the greatest. It's something you eat or drink and you get sick from it, but nothing too horrible. However, it can cause more serious complications such as meningitis and septicemia, usually in fetuses, in a developing fetus, as well as immunocompromised, like elderly, sick, or even in pregnant women that can be immunocompromised. Because it is a rare bacteria that can cross the placental barrier and cause issues in fetuses, it is always a big concern when there's Listeria outbreaks. The 2 biggest groups they're concerned about are pregnant women and elderly, is because it can cross that placental barrier. It can lead to miscarriages and stillbirths from the damage that it can do. To diagnose it, we can grow it, we can culture it. It is a flagellated bacteria and it's very active in a fluid. So it does what's known as tumbling motility, where it kind of does little somersault looking things when we put it and look at it in a fluid. It is treatable. Most antibiotics are effective, but the best is just not to get in the first place. Avoid certain foods like raw milks, those that are not pasteurized, any foods that may be contaminated with soil. So fresh, unwashed vegetables or fruit can all be at risk, as well as certain soft cheeses, sprouts, certain deli meats. So a lot of these are usually discouraged from eating while pregnant. Then we have the group of the mycoplasmas. They are the smallest free-living microbes. So they can live on their own. They don't have to live in a human full-time. One unique thing about them is they are pleomorphic. They can change in their size and shape, and it's because they don't have any peptidoglycan at all. So they actually, when we gram-stain them, show up as a gram-negative, but genetically they are gram-positive. So they don't have the 2 cell membranes like gram-negatives do, and like they are a gram-positive bacteria because of all of the other characteristics. They just don't have a cell wall, so they don't have the peptidoglycan to hold its shape. So they change shape a little bit. They are a little harder to grow. They usually require various growth factors that we have to provide either in a host or from some type of lab media. Many of them can cause issues by growing in the mucous membranes of the respiratory and the urinary tracts, causing pneumonia and urinary tract infections. The one most common mycoplasma we seem to hear most about is Mycoplasma pneumoniae. Yes, it's got the word pneumonia in its name, and it can cause pneumonia, but it causes a different kind of pneumonia known as atypical pneumonia, or you may have more commonly heard of it as called as walking pneumonia. So it's not normal pneumonia. Most normal pneumonia, you get enough fluid on the lungs, it becomes difficult breathing. We don't have enough gas exchange, a lot of times hospitalization. Well, atypical pneumonia, we don't have any white blood cell response. Like you're not seeing a huge number of like neutrophils or monocytes. It's usually a much milder disease, not requiring hospitalization. Usually starts off with fever, malaise, tired, sore throat, headache. After a couple weeks, not days, it eventually can lead to an unproductive cough, maybe an earache. Something where you've got something, but it doesn't go away for a long time. It is a very slow growing organism, a very slow growing bacteria. It's spread by nasal secretions. And children the ages of 5-15 are at the highest risk. Part of it is, the poor hygiene, blowing nose, wiping noses on their hands, not cleaning their hands, touching everything. Diagnosing, usually we use ELISAs to confirm it. We don't grow it up because they're such slow growers. Instead of taking 24 hours to start to see these growing into a colony in an incubator, it could take a couple weeks before colonies might start to show up. Our best prevention, if it's spread by nasal secretions, best and easiest prevention is good hygiene, washing hands all the time. Our next genus of bacteria that's gram-positive and rod-shaped but can't make endospores is Corynebacterium. So they are pleomorphic, and most and many of them are non-pathogenic, normal skin, normal oral flora. Some of you in lab may have even identified, depending which bacteria colony you chose, a Corynebacterium as being found in your throat. Totally normal oral flora, non-pathogenic. The one Corynebacterium that is pathogenic is Corynebacterium diphtheriae, which causes the disease diphtheria. One of the things that it causes, it forms what's known as a pseudomembrane at the back of the throat. The toxins will start to work with enzymes and block enzymes from working, from clearing the back of the throat, from getting rid of dying cells. And then you combine these excessive cells with white blood cells that are responding to the bacteria, some of the intracellular fluids, and it causes them to form this large kind of clump at the back of the throat. The pseudomembrane can grow large enough that it can actually block the full throat and block airway, leading to suffocation. Diagnosing it, looking at the back of the throat and seeing visually that pseudomembrane is a huge diagnosis. Otherwise, we do have a very specialized media called Loeffler's media that we can grow it up on. Treatment is usually the antibody to neutralize the toxin, as well as penicillin or erythromycin. And if that pseudomembrane is large enough where it's causing issues, we can surgically remove it. It is, however, very preventable, because we know we do have a vaccine against that toxin, the diphtheria toxin that causes that large pseudomembrane, and it's part of the DTaP. It's diphtheria, tetanus, and pertussis. So since we've started to vaccinate, we've only had about 12 cases of diphtheria in the United States in the past 15 years combined. Before this vaccine came out, we had hundreds of thousands of cases every year. So we're looking at hundreds of thousands of cases a year versus about one. So it is a very effective vaccine against this particular bacteria toxin. And then this last part I've got on a separate recording.